how far are we from a humanitarian crisis in India?
Oh, I mean, we're on the brink. The stories that really worry me the most is hearing about shortages of medical oxygen. I mean, to think that, you can save people's lives by supplementing their oxygen and they just don't have it. Oxygen, something that's easy to make. That is really, I think, a severe tragedy.
How close are we to shifting to, say, 1947 and the starvation of Europe, the Netherlands, post-World War II Europe? How close are we to where there will be a call for international developed nation and American responsibility to assist India?
Oh, we are there. If the call hasn't already been sounded, let's sound it now, because there is clearly a deep, deep struggle there and they need help. And, the United States is not going to be back to normal, fully safe until we help countries end these very concerning surges of these cases.
Based on the surges that we have seen, how much has the end of the pandemic been pushed out?
Well, I mean, it's really hard to say. I mean, we still have parts of the globe that haven't gone through this yet. And you don't want any country to go through this where you see a massive surge of cases. But any country that has not yet had a surge of cases and is not actively vaccinating its population remains at risk to exactly this scenario. I think earlier there were countries that maybe breathed a sigh of relief that somehow assumed that they escaped the worst of this pandemic. But we're seeing quite clearly that that's very much not the case, that many parts of the world still remain deeply at risk. So I worry about these headlines continuing for a year or more unless international partners get together and help share some of the vaccines that are there. We need to absolutely make more vaccines. There's clearly a shortage of medical supplies that needs to be addressed. So a lot of work that the globe can do to help countries and to, try to lessen some of these hideous tolls that the pandemic's already had.
We need to make more vaccine and we need to convince people to actually get inoculated. John touched on the fact that there is a slowing pace of vaccinations in the United States. How concerning is that?
It is quite concerning. I just read a study about an outbreak in a nursing home where most of the residents were protected with vaccines, but only about 53% of the healthcare workers in the nursing home here in the U.S. Had been fully vaccinated. And unfortunately, one of the residents who had been vaccinated, and this can happen particularly in medically frail individuals, died. So this is a real problem. And then, of course, we're hearing about states pulling back on ordering vaccine, that they are not having the kind of uptake that they had been having. This is something that I think we have to address with much urgency. I think there are some people who are probably just trying to wait and see. I think there are some people who don't feel that they want to get vaccinated, but we need to reach both of those people, both of those groups of people, and convince them that, your time to get vaccinated is as soon as you're able. And the faster we do this is the faster we get back to normal.
What a tough moment to be a leader of this country right now and make this decision, Doctor, because there is so much pressure to take some of the supply here and allocate it to the rest of the world where it's needed most right now. How do you make a decision like that when some parts of your country have decided they don't want this vaccine?
Sure. Well, it is a tough decision. And, every elected official, their first responsibility is to the people who elected him or her. In this case, though, the United States has more vaccines than we need. Even if every single American were to get a vaccine, we still have more than we need. And so I think it is important for us to consider donating, at least to cover some very high risk groups like healthcare workers that are working across the globe. They show up every day, put their lives on the lines to save people's lives. We should be able to protect them. And the U.S. has enough vaccine to be able to help in those efforts.